Hello, I'm Dr. Lynda Young, and welcome to Health Matters from the Worcester District Medical Society in partnership with WCCA TV. So today we have a very interesting topic to talk about, something that I frankly didn't know much about, but figured I probably have been doing for a while. But we have somebody who's an expert in this with us today. So I'd like to introduce Dr. Michelle Dalal. Dr. Dalal is a pediatrician with Reliant Medical Group in Milford, Massachusetts. She's an associate professor of pediatrics at UMass Chan Medical School and is board certified in pediatrics and lifestyle medicine. She co-chairs the Pediatric and Adolescent Lifestyle Medicine Interest Group at the American College of Lifestyle Medicine, which I didn't even know existed, but we're going to hear about that today. She recently co-authored the Teen Lifestyle Medicine Handbook, The Power of Healthy Living. So welcome, Michelle. Thank you for joining us today.
Thank you so much for having me here.
So here's my first question. What is lifestyle medicine?
Yeah, I get asked that a lot.
I would think.
Lifestyle medicine is really the use of evidence-based lifestyle interventions. Namely, there's 6 that we kind of promote, and those are whole food, plant-based, or a plant-predominant diet, making sure that people have restorative sleep, increasing physical activity, managing stress, avoiding risky substances, and ensuring that there are positive social connections, which really, we want those to be the primary interventions to help prevent, reverse, manage, and treat chronic disease.
That's very interesting. So, and very important in your whole life, and it applies to everybody. Mm-hmm. So, why is it important, and why now?
Yeah, it's a great question. Chronic disease is the leading cause of death and disability in the U.S., and U.S. rates of chronic disease, as we all know, have skyrocketed, and many of these diseases are fully preventable. In fact, the World Health Organization states that 80% of stroke and heart disease is preventable through diet and lifestyle, and 40% of cancers actually might be preventable through diet and lifestyle. So I think we've learned a lot over the years, and we can even look back and see that there are actually biological changes that occur when we promote healthy lifestyles, and when we don't have healthy lifestyles, there's changes that occur. Many of you may have heard of Elizabeth Blackburn, who got the Nobel Prize in Medicine in 2009 because she unraveled the mystery of the telomere. And the telomere is this end cap on the chromosome, and this end cap on the chromosome can actually lengthen, and when it lengthens, we know that is something that's found in people who live longer. And actually dietary changes, physical activity, are good, lots of physical activity, making sure you get enough sleep, that can actually lengthen your telomere. So your DNA actually changes by ensuring that we sort of embrace some of these healthy lifestyles, and that's why it's so important to talk about it. And studies have also shown that by having, again, inactivity, some of that poor sleep, poor diet can actually decrease the length of your telomere. So that is especially important sometimes when we look towards women during their childbearing ages, because if we can promote healthy lifestyles with them, we can actually pass on those genes to their children.
Oh, wow. Now that's interesting, because I thought your DNA is your DNA, and it's not going to change, it's not going to grow, it's not going to get shorter or whatever, so that is really very, very interesting. And I'd heard that name before, but I had never known what she did, which is really a shame that I didn't know that. But anyhow, that's very, very interesting. So when did this start coming about? When did this start being a thing?
Yeah, it's really been around for many years. Some of the early pioneers you may have heard of, Dean Ornish is one of them. And so there's now many lifestyle medicine institutes around the entire country that are actually promoting this, more so actually in the West and the central part of the United States. And so we're really looking to bring that to the Northeast and really have more people learn more about these various facets, because what we found over time is that although nutrition was promoted, and we know about it, there's not enough knowledge about it, either during our clinical interactions or even medical providers when they went through residency. I'm talking decades ago, nutrition wasn't necessarily something that was had enough push behind it during that time period. And I was lucky because when I went to undergrad, my major was nutrition. And so I was really excited when this work was coming about because I felt it fit very much so in terms of what I had already known from before.
So interesting. So I'm thinking about all these questions that I have to ask you. So I'm just thinking how hard it is to make a difference.
Absolutely.
And I mean, as you know, I'm retired now, but I practiced pediatrics for about 40 years. And we did talk about this stuff, but it was never a big focus for us. And it was difficult to change people's lifestyle. Very difficult. So where does the approach that this does, where does this make a difference? Whereas before we never felt that we made very many inroads.
Yeah, so I think that one of the things that we found is it takes time for people to make change. And really we need to discuss setting goals. We want to discuss how to make those habit changes and really have time to understand the barriers that people have to making these changes. And so one of the great things about lifestyle medicine is we learn a lot about motivational interviewing, which is really a clinical strategy, and it helps guide patients and helps us really work towards making sure that we build their own and look at their intrinsic motivation for change. And we don't want to be the authority per se in terms of what needs to be done. We want them to kind of see within themselves why they need to make these changes and move them in that direction gradually. So sometimes we'll talk a lot about setting SMART goals. So SMART goals mean goals which are specific, measurable, actionable, realistic, and timely, and really being able to follow those from one clinical interaction to the next so that people have something to really work on. And so for example, during my clinical visits, I like to set a goal or two before they leave so that next time I see them, they have something that they can work on, and I can ask them, how did that go? What do you think could help in making you get to where you want to be? So I find it amazing that a lot of people actually know what will keep their bodies healthy, but just making those habit changes can take time.
So that's your motivational way to do this, which I think is very interesting because that's generally not something that we do in the office or in the clinic or wherever you're practicing. And I think that giving somebody a set thing to do, not a whole lot of stuff, but you can come in and say, well, you need to get more activity, you need to lose weight, you need to do this, you need to do that, and you go, yeah. And I think that is an interesting way. Can you tell me a little bit more about this motivational interviewing?
Yeah, absolutely. So the principle is really a lot of trying to increase someone's intrinsic motivation. And so we want to move them and help them. We want to see actually where they are in their stages of change. And so there's various changes. So you can sort of be in the stage where you're just thinking about making changes. You might be in the stage where you're ready to make those changes. And we want to find out where someone is. So first of all, you might just be delivering some information, some knowledge about something to them. And then you might want to ask, or we might want to ask, how likely or do you feel like this is something that you want to be able to work on over time? And if so, what would help you get to that place over time? And so really finding out where they are. And sometimes during the visits, a lot of us feel like, I think over time, we want to really help people, but we want them to change right away. And it's not that quick. So sometimes you just have to move them to the fact that they just start thinking about it. And once they start thinking about it, maybe the next visit, you can really move them to actually taking action.
I think that's a really interesting way to try to get people to change what they're doing. I think one of the things that we as physicians do is we give prescriptions. And we say, well, you have this, so here's a prescription, and go to the pharmacy, or actually it's electronic, but I know that, but and go and pick up your prescription, and don't forget to take it with this or whatever. So how is this different?
Yeah, so this is a little bit different because we're really putting lifestyle at the forefront of everything. And so for example, here's a great example that I find is helpful in that when we're talking about, changing someone's lifestyle, or even when they come in with a problem such as high cholesterol or type 2 diabetes, we sometimes will move straight to, okay, these are the types of medications you need. These numbers are very high. We're very worried about how it can affect your heart in the long run. And so we find that practitioners sometimes will just move to, talking about the statins. And they'll talk a bit about nutrition and the importance of that, of course, but maybe not in the great detail that it actually needs at any given time. So really focusing and maybe even giving that option that actually, if you follow a whole food, plant-based or plant predominant diet, which includes lots of fruits, vegetables, whole grains, nuts, seeds, you can actually reverse this almost completely. And there's programs out there. One is called the CHIP program. It's also known as the Complete Health Improvement Program. They've actually shown results within 8 weeks with reversal of type 2 diabetes. Maybe not complete reversal, but at least being able to be to start coming off medications. They've also shown that you've been able to reduce medications with cholesterol. And so it's great. And I think a lot of people want that because prescriptions, as we know, have side effects. And so sometimes people take them and then they stop taking them. And this is something where if they build this into a habit and really embrace it, they can just follow it for the rest of their lives without needing to, take a pill and also pay for the pill. I mean, it's very expensive. All these prescriptions add up. And so the cost of healthcare.
And I think it's interesting because a lot of people, their mindset is, well, I really don't want to change my lifestyle, especially if it's, let's say you're a mom with kids and you're working, and to come home and have all of that food available when I can drive through any kind of a takeout place and get something where they're not going to give me any lip about it because they love all that stuff. And I don't have to do anything. I just pick it up and throw it away when I'm done. And that's not a good way to do things, but that's a very hard lifestyle to change when you have a life like that.
Absolutely.
How do you handle that as a pediatrician? You see it all the time.
Yeah, absolutely. So I think, when you talk to kids and parents, I think they know what are the healthiest foods that are out there. And they'll be able to tell you that they'd like to make some of these changes, but it's hard for them. So oftentimes it'll be with very simple things. We'll give out recipes. We'll start talking about ways to prepare very simple foods for them. If they're going out and going through the drive-through, for example, at any given restaurant, there often are sides of vegetables or fruits. So even starting to incorporate that into each meal or snack is a start to moving in the right direction for yourself. So yes, you're not going to be able to make all the changes at once necessarily. Some people are able to, but most people are not. But even if we can give them strategies to start to incorporate these various changes slowly but steadily, we know we can move, that mom and also the kids in the right direction, hopefully adopting these changes for their entire life.
And I was just thinking about how moving this to like an adults, let's say the kids are gone and it's you and your husband or your significant other, your wife, whatever, and you want to change, but you've been so involved in all of this for years and years and years. I could imagine just say I go to the doctor and the doctor says, well, you have high blood pressure, you need to lose some weight, you need this, you need that. And I go home and I think, well, I should really sit down and say, listen, I've got to change this and I need your help. So this is where the relationship stuff comes in. Can you do a little bit more about that?
Yeah, absolutely. So hopefully, it depends on who you want to go to get that help, actually. So there's people that can help you. Of course, there's your doctor who potentially could help you. There are people within the community who potentially could help you, such as programs. Your partner could potentially help you. So there's various avenues to get that help. So the first thing is we really want to help bring that knowledge to someone. So there's, of course, books you can read. There's resources that are out there to kind of gain that knowledge. Then we want to help shift that attitude, which if you're coming in and saying you want to make that change, your attitude already has shifted. So that's wonderful. And then we want to give people the skills to be able to make those changes within their current life, their current lifestyle, I should say, because at different points in your life, you're doing things very differently. And so we want to make sure that whatever we want to work towards, we can help you with that in wherever you are in your life at this time.
So you had made a point about chronic illness,
Yeah.
which is a biggie, obviously. And unfortunately, we Americans have a lot of chronic illness because of our lifestyle. So I'm thinking about how somebody would come and say, well, you know, I can, you gave me a prescription for my blood pressure and it's fine now. So what's the point?
Yeah.
Or thinking, when do I stop taking this? It's not like an antibiotic and you're done in 7, 10, whatever days. You're on this for the rest of your life, most likely, unless you do something about it.
Right.
And as you said, there are side effects.
Yes.
So I think, how would you approach that when somebody says, you know, I'm just, doc, I am just not going to do this, just give me a pill?
Yeah, absolutely. So I think, again, we meet them where they are. So that might be the easiest thing for their lives at this moment. And if that's what's keeping them healthy, that's great. But we want them to know that there are options for them and that perhaps by making some of these changes, there's going to be an opportunity to come off those medications. I think there's very few people, at least that I know, who will say, you know, I want to take pills for the rest of my life,
Yeah.
for sure. You know, most people will say, yeah, let me do something different if I can, you know, if they can. So it's really moving them towards that direction. That's the next step for us.
And you also brought up the expense of it and how people, you know, they run out of their medicine, they cut it in half, and it's really, they know that's wrong, but they have other issues with it. And again, changing their lifestyle would be really very helpful. So you had mentioned something about an AIM-trained medical provider. What is that?
So it's ACLM, trained medical provider. I believe that's I think that's the reference.
Yes.
That's, American College of Lifestyle Medicine is an organization that really promotes lifestyle medicine. And so through them, you can, and actually it's through the American Board of Lifestyle Medicine where you actually get a certificate. So you do a number of hours of training on these very 6 specific pillars that I was speaking about before. I think it's good to kind of get into the details of that. You know, so the healthy diet we spoke about previously.
Yes, go ahead further with that.
Restorative sleep is really important and key. So not only just the quality, but the quantity of one's sleep can influence their immune system. It can influence, again, those telomeres in your DNA. It can influence actually your mood. So we're seeing a lot of mental health issues nowadays, and perhaps focusing on these things such as sleep can make a big difference in how you feel the next day. I mean, as we know, if we don't get enough sleep the next day, we're pretty cranky with our partners, you know, sometimes.
Sometimes.
That can happen. So the next, you know, pillar is sort of discuss, you know, the physical activity, and really there are guidelines that are out there for Americans that you can look up, but it's making sure that we can integrate that physical activity in a way that's easy for everyone. So that sometimes involves also changes such as, you know, working with schools and working with other partners in order to make those changes within communities. For example, it'd be great if we had open access to places where people could move that are well lit, and that would be inexpensive so that everyone can participate in movement. It would be great if we had sidewalks in every community so, you know, parents could walk their kids to school if they choose to do that. So that's within that community. So working towards that also is another goal. Stress management. So we talk a lot about mindfulness, mindfulness in eating, mindfulness in general, meditation, breathing, and really bringing that to kids and adults starting really early on, because that in and of itself can influence things like high blood pressure.
So mindfulness meaning you got to think about it.
Yeah, absolutely.
Is that pretty much an easy way to say?
Yeah, absolutely. You know, thinking about you and thinking about just being there and in the moment and not necessarily stressing about all the things that we stress about all the time, and even taking some brief time during the day on a daily basis to allow yourself to just chill, I'd say, makes a big difference. It's hard to do sometimes, but sometimes you have to think about it to do it first, and then hopefully it becomes a habit.
Right.
The next thing is really improving those social connections, because we know loneliness is actually a big factor and actually makes a difference for those who are experiencing depression. And so making more social connections, sometimes it can be through friends, family, it could be through volunteering. Just being able to have those connections can make a big difference. And I think I covered all 6, I believe,
Yeah, I
at
think
least.
that was 6.
Yeah. So basically, the training is to cover those 6 pillars so that you understand a little bit more about that, you gain that knowledge, and then you learn how to be able to promote that within your practices such that, people can really benefit from that. So we do the training. There's actually an exam that we have to go through at the end to make sure we learned what we needed to learn. There's some practical pieces of it where we have to present clinical cases also. And so we have, I don't know the exact numbers, but there are many lifestyle medicine boarded practitioners nowadays. And so it's great to have, if somebody wants to have someone who can really sit down and work with them in a manner where they have more time, they can perhaps seek them out.
I think it's a great approach to just getting better with your health and with everything that comes along with that. I'm also thinking about how going to a standard doctor's visit or with a nurse practitioner or any of those instances where you have an appointment and you're going in, it's a well visit.
Yeah.
You're not there because you're sick, but you could still do it then, but usually those visits are very focused and very short. So how do you have the time to go over everything that you're supposed to? Again, especially as a pediatrician where we have to do all this, what we used to call anticipatory guidance. So you're seeing a 6-month-old and you have to tell them, now watch out because this is going to happen when they're 9 months and this is going to happen when they're 12 months. So how in the world do you fit all of that in a visit and get the labs gone over, get the shots that they need, get this, that, and the other thing?
It's hard. I mean, I can't say it's very easy to do. Sometimes I'm lucky enough to be able to schedule visits where I get a little bit more time. And I can't say that every visit we go through every detail of what we want to. We try to get some information ahead of time from the patient to know where they are at with certain things. And if it looks like they're doing pretty good with that, then hopefully we can say, all right, great job, keep doing that. And for those things where they can maybe work on things a little bit differently, that's where we sort of put our focus on. During that visit. And it's not just what we want. Again, it's what the patient wants because they may be coming in with a set of issues that they want to deal with. We want to make sure we deal with that first and then focus on maybe a couple changes that they could make. Because again, it's a well visit. You're hoping that you're giving them information to keep them well, over time.
That's a good point. Yes, yes. Now, I'm a very positive person, so I can't believe I'm saying this. I can think of a whole host of reasons why you can't do this. So in particular, if you're looking at people that live in unsafe neighborhoods, people that live where they're miles away from a grocery store, they can only go to a convenience store and the only thing they can buy there are frozen dinners.
Absolutely.
That sort of thing. That's very difficult, but you must have. Can you tell me some successes where that has worked with you, and how did you do that?
Yeah. So I think, again, it's a little bit maybe a mindset change in some ways because we know everyone can make change if they wish to. You're right, maybe not the exact change, so maybe you're not going to be able to walk to school in that unsafe neighborhood because you never will feel comfortable doing that. But if we're looking at, for example, incorporating physical activity, they might be able to do things at home, so we can give them some simple bone and muscle strengthening activities. We find that many people have access to a cell phone nowadays, and so even suggesting certain apps may be helpful for them. In situations where they may not be able to have access to fresh food. Frozen food is good, actually. Flash frozen food has as many nutrients, and a lot of people don't know that, so they just say, let me go to the easiest thing. But even telling them about the fact, that frozen food is great, like keep that with you. That's an easy way to have fruits on a regular basis. We often talk about blending frozen fruit into a sorbet in some way and having kids eat that almost like an ice cream. So giving them, again, simple tips with that might make a difference. There's also many families who have to use a food bank, for example, for food. And one of the things we'd like to do over this upcoming year is really continue to work with food banks and helping people know how to use those foods and make healthy meals. And so that provides a little bit of education. And so that's another goal that we have in general.
So I think education is really the key to all of this. I was just thinking when you were mentioning about apps and that sort of thing that one time I was babysitting my grandchildren, and I heard them kind of jumping around in the television room, and I go in there, and they have this app on that is a baby, not a baby, they're not babies, a yoga thing for kids.
Yeah.
And they're just jumping all over the place, and after about 20 minutes, they're sweating and everything, and they love it because it gets a lot of stress out.
Yeah.
So those are some of the things that people would have available if they just knew about them. Do you have any resources that you give to patients?
Yes, so we have a set of resources that we've developed through the American College of Lifestyle Medicine. We've been very lucky to have an entire marketing team who can work with us. And on the website, for those who are members, clinicians can actually access all those materials for free if you're a member of the American College of Lifestyle Medicine. So one of the toolkits that we developed within our interest group actually was a toolkit about adolescent depression, lifestyle medicine changes for adolescent depression, because we do find that people who are in the initial stages of depression, perhaps we can find different things for them to change, just simple things within their own lifestyle that can prevent the progression of that depression. So yes, we do use those within our clinic visits. The other nice thing that we've developed, you were talking about prescriptions, is actual prescriptions such as playscriptions or sleepscriptions. We're actually giving them a prescription to go and play more or to sleep more, and perhaps different tips with that. And so sometimes we'll hand those out also as ways to encourage people to make those changes.
So we are getting to the end of our time here, but I want to give you enough time to something that you would like us to know that we didn't cover, and go to it.
Yeah, no, I think that lifestyle medicine is really a great way to really take control of our health in general. I mean, we all have things that we can work on over time, and so I hope that more people will learn about it and learn about the various facets of it, because we know we haven't fully embraced the full power and potential of prevention yet. We're still focusing on pills and procedures, and so if we can really incorporate the facets of lifestyle medicine, I think we can make some big changes.
How could we make it more, that more people are doing it?
Yeah.
Make it more not universal necessarily, but get people to incorporate this in their lives.
Yeah, so other than the knowledge and sort of the skills that we can disseminate, I do think it would be great for policymakers to make some of these changes within communities. There's many things that we can do, as we talked about before, with having more open spaces, for example, having those sidewalks, being able to access healthy foods through the workplace, through the schools, and so really focusing on these different things that we can do will make a big difference.
Oh, great. Well, thank you. This has been really very interesting. I've learned a lot, and I want to thank you for being with us today. I think we will offer some resources, and so that people can look this up, and if they wanted to take a look at the give me that
CLM.
ACLM.
Yes.
So that they could get this information, if they can look online, if they have access to that. So thank you again very much for this. And thank you all for watching. I'm Dr. Lynda Young for the Worcester District Medical Society, and this is Health Matters. Thank you.